stream?
Yeah.
Yes, ma'am. The stream is live.
It's written live in 26 minutes.
Please refresh your screen, ma'am. We'll be able to see it.
Yeah. Yes.
Okay, so we're just waiting for the others to join. The 14 people joining. 2 more minutes and we'll start.
Yeah. Let me know when I'll be audible, okay?
Sure, ma'am. Yes. Good evening, everyone. I see that the 16 people live and numbers are tickling in slowly. We'll be starting in a minute or two. Thank you all for joining. I hope this will be a very interactive session. I will give you details about how this webinar will work and how you can interact with the speaker as well within 2 minutes once the webinar starts. Thank you for joining and being patient. Ma'am, we are about 30 concurrent viewers right now. I think we can go ahead and start.
Yeah.
Yeah. Okay. So, good evening, everyone, and very warm welcome to the SHS Society for Healthcare Simulation India's monthly webinar. We are now here with Dr. Lulu Sharif Mohammed, who is Professor in Anesthesiology and Head of Department of Healthcare Simulation Education in Father Muller Medical College, Mangalore, Karnataka. Dr. Lulu is a professor in anesthesia and is presently heading the Simulation and Skills Center at Father Muller Medical College. Father Muller Medical College is one of the earliest simulation centers in India, and it's quite well renowned for its MU activities, for its simulation activities. Ma'am has completed a fellowship at the Manipal Fimer International Institute for Leadership in Interprofessional Education and is presently pursuing the second year of Masters in Healthcare Simulation and Patient Safety at National University of Ireland, Galway. She is the first applicant from India to get certified as an advanced healthcare simulation education educator from Society for Simulation Healthcare USA and has been serving as a member of the certification subcommittee of the society since last 3 years. She is also an executive board member of our society, the Society for Healthcare Simulation India, and is the vice chair of operation board of our official journal, the International Journal of Healthcare Simulation Advances in Theory and Practice. Her special interest is in the advancement of field of simulation using interprofessional education. So before ma'am starts off a webinar, I'd like to briefly introduce our own journal, the official journal of the Society for Healthcare Simulation India. Hi, Josh. Now, this journal is internationally certified, peer-reviewed, open access. We make 4 issues per year, 2 innovation supplements, and also conference supplements. The journal is currently accepting abstracts. So we really encourage you all to go ahead and give your abstracts for submission. You can give your submissions on their website, ijosh.com, and you can also email the editor at ijosh.com. So the editor-in-chief is Dr. Deborah Nestor, who is world renowned for simulation and it has multiple Indian members as well on the board. It has a complete pan around the world expertise in simulation, and there have been already three editions have been out. So I think it will be a great opportunity for people who are interested in simulation and skill training to go ahead and publish what they're interested in. Without any further ado, I'll hand over the microphone to Dr. Lulu ma'am so that she can go over the webinar. Ma'am, top tips on managing a simulation center in Indian perspective. Over to you.
Yes, thank you so much, Raj. Am I audible?
Yes, ma'am, very much.
And is my screen visible?
Yes, ma'am, clear.
Yeah.
Please go ahead.
Thank you so much. So, good evening, everyone. Thank you for joining in. Before I begin, I'll just have a few disclosures. Whatever products I'm mentioning or services I'm mentioning, I do not endorse any product as such. No financial interest related to this presentation, no conflicts. I'd like to disclose that I'm an advisory member of our state university, both Karnataka and Kerala, for helping them set up simulation centers. And I would keenly like to acknowledge my simulation center faculty and learners, as well as my FEMA faculty and fellows for whatever I have learned over the last 7 years. And what I'm going to share with you is the content based on my experience as the center lead. So during the feedback and the query sessions, I would really appreciate if you would give me suggestions or give us more innovative ideas on how can we do things better. So moving on to the topic, I would like to reiterate that this is the second part of our session on setting up a simulation center. The first part was beautifully done by Dr. Purva and her team from Hull University, which gave a little global overview of what was happening. And to continue that, due to high demand on presenting something related to the Indian context, we at SHS have decided to present this webinar to you. Top tips to setting up a simulation center. Actually, what I'm going to share with you is we had done a needs assessment based on this acronym, which I came up during one of my workshops in SRMC. And SRMC Chennai, they have presented it Dr. Purva had presented it during one of the ASPE conference. And this is also published in the BMJ STEL. So based on the perspectives of what the participants had mentioned, I would like to go ahead with this webinar in a little more interactive manner. So I request you to please keep your fingertips ready to chat with us using the YouTube chat, whether you're on your laptop or your mobile. Make sure that you are in a position to interact with us using the chat. And Raj is kindly agreed to help me with reading the chat and letting me know what your perspectives are and how you are interacting. And we can have a hopefully a very enriching experience on what challenges you're facing, what solutions we can come up, and have a summary at the end of how we can go about. So some terminologies which we'll be mentioning, I want to clear that first before we move ahead. Simulation center, facility, skill lab. So these are the words we use. Simulation program used more in the Western side. Simulation course, which is a part of the program. So these terminologies are referred from, I've already mentioned, from the SSH, one of the IMSH meetings. If you are interested, I'm more than happy to share the reference with you. So when we say simulation center, facility, or lab, it's more like a physical location which has a few equipment and you're delivering a few services. So there are two models. Generally, it is one is designed for a particular program. So you have a simulation or a skill lab in the nursing college. So it's for the nursing undergraduate or postgraduate program. You have another set like what we have here and most of the medical colleges right now. It's a comprehensive center supporting multiple programs. So we at Father Muller Simulation and Skill Center, and just like how Raj has it in GSL, cater to the medical, nursing, allied, multiple programs. So that these are the two kind of simulation centers or facilities which are broadly classified. Now, when we come to what is a simulation program, So a simulation program as such, the word simulation center is less used abroad, unlike in our context. Simulation program is a group of courses. You have simulation activities there, which are designed to meet the needs of that particular stakeholder group. For example, we have a simulation nursing undergraduate program. We have a medical undergraduate program, postgraduate resident program. We have the hospital quality improvement program, or a hospital healthcare provider training program. So this is a huge program. And simultaneously, we have comprehensive life support programs, emergency courses. So this whole program, we have our AHA program, we have our Jiva Raksha, which is our Karnataka University, is one of a very flagship program. Now, under this program, there will be multiple objectives and courses, and each program, now, for example, everyone's familiar with the AHA program, which uses the skill lab and the mannequins. So the AHA program has a multiple courses. I'm mentioning AHA because it's common to all. Y'all can understand when I say. So you have the BLS course, you have the ACLS course, you have the PALS course, and it can be conducted in many different simulation centers across globally, which have the same similar technology as such. Now, what is a course? It's a part of the program which has a set of objectives. Now, under this course, you have a set of simulation activities which meets part of the objectives of the simulation program. Now, our Jiva Raksha program has the ECLS course for the medicos, the ENLS course for the nurses, the allied, the BCLS course for the allied students. So all these courses together make our Jiva Raksha program, and these objectives meet up together. And we do it, it's a mandate in Karnataka right now, who forms under the Rajiv Gandhi University. So I hope you've got a picture on these terminologies. Now, to break my monotony, I am just going to keep an eye on the chat box. And Raj, I need your help here. Does your institute have a comprehensive simulation center or a skill lab? Yes, no, is it ongoing? So when I mean comprehensive skill lab, is it a central skill lab catering to multiple programs? So can I have a yes or a no or an ongoing? I'm also keeping up. Raj, if you could.
We have a couple of yeses, ma'am. Dr. Hemant Kumar, Dr. Ganesh Mailapuram, Nan Netrathan, Pragdish Raja, yes, yes, yes. Vijayan Basudkar, yes. Hello, Vijayan, nice to see you. Dr. Tamadoshi, yes.
Yes. Okay. Yeah. So as the chat is coming in, I can see that most of us right now have, and one of the main reasons we have it right now is because it's a mandate. It's a regulatory body requirement right now in this present from 2019 onwards, when the regulatory bodies have come out with, and the Nursing Council INC has come out with requirement for skill lab way ahead before even the Medical Council. So thank you so much for mentioning it in the chat box. Now all of y'all do have a simulation skill lab setting. So based on this background, we will try to identify the targeted needs, and based on your needs, what could be the related design of a simulation center. Now, what I'm going to discuss is probably a few of y'all who don't have and you want to have it, and a few of y'all you have something existing and you want to renovate or build upon it. So we are going to identify the targeted needs, whether it's only academic related, whether it's hospital, or it's a standalone, like Symbiosis Pune. They have a standalone simulation center catering to the areas around. So what we will hopefully try to identify and then relate our design of the center to that. We will hopefully try to enlist the resources required in setting up the center. And when I say resources, the infrastructure, the equipment, and most important, the human resources. We will also, over the next 30 minutes, discuss on the need to develop simulation programs, and more so simulation policies and procedures. And we will also discuss, hopefully try to describe, what are the most common challenges right now our educators and administrators are finding to sustain a simulation center, because most of you already have a simulation center. And let's see if we can come up with something, possible strategies to overcome. And like the webinar brochure mentions, I will definitely talk on the skill lab requirements as within the Indian context, both Indian Nursing Council as well as our NMC. So how are we going to go about the next few minutes? I can easily show you Father Muller Simulation and Center and say, okay, this is it. Or I can show you, I visited GSL, I visited, the nearby centers. We can just tell you, okay, this is how it's done. But it's not, because each skill lab or in each simulation, I'm going to use the word skill lab because it's most commonly used, is catered, and it needs to be customized to your context, to your target learners, to your resources, and to your regulatory body requirements, state or otherwise. And that is why we need to know what your perspectives are. So you need to put on your thinking hat and you need to reflect and introspect and let me know, so that together, by the time the session is over, y'all will have a clear idea on what you may require rather than we serving it on a plate to you. So it's going to be a little brainstorming session, a virtual discussion using YouTube chat, and we'll just summarize and then leave a couple of minutes in the end to answer your queries. So now let's see, for all the participants who are watching now, you have been entrusted by your leadership to assist in setting up a simulation center, or to revamping, or to renovate, or to upgrade for your existing center. So let's see now how we can go about it. So Raj, eyes on the chat box. The first question, okay, is why do you need a center? Why do you need the skill lab presently? So can you just let me know in your chat box? Why do you want to upgrade your existing center, or why do you need to set up a new center? If you could just use the chat box and let me know, we can use a couple of minutes.
Waiting for some responses, ma'am.
Yes.
People are typing.
Yeah. Yes. Yeah, sure.
Just an update, we have 70 people watching right now. That's a very good number.
Yes, thank you.
Okay, Dr. Pragadish Raja says to improve skills among students.
Okay.
Dr. Pragadish Raja has also expressed interest to become a lifetime member for SHS. So thank you.
Thank you, Raja. I think, they are typing, so we'll just give them a couple of minutes.
Yes. For learning and assessment.
Okay.
Ganesh Mailapuram says improve clinical knowledge.
Okay.
To improve patient care. Not everyone gets to practice skills on patients.
Very good. Thank you so much.
The efficiency of patients. Patient safety is the recurring theme here.
Yes.
To create appropriate clinical scenario-based learning. NMC requirement, develop trainers for skill development.
Great.
Thank you, Dr. Hemata Kamat.
So NMC requirement. Yes.
Finally getting to the
yes.
To give opportunity to students to improve skills for TOTs.
Yes. TOTs, yes. So beautiful. Thank you so much. So basically, I've got a requirement, regulatory body requirement. We've got definitely for education, to train our UGs, PGs, nursing, medical, whoever they are, and for hospital, integrating hospital program for improving patient safety. Anyway, even if you train your students, in the end, it leads to patient safety. So to prevent errors and to upgrade our students' skills, lack of patience, okay, ethical reasons on patients. So basically to enhance your skills. And one more thing I really like there is faculty development. So we have that gap analysis. We know what the needs are. So everyone agrees that we need it. Now, let's see in your context, from whichever part of the country you're coming or whichever part of the setting you're coming, who are going to be your target learners? Are they going to be students from whichever profession? Are they going to be professionals working, corporate setting or your hospital setting? Or are they going to be community? Like, patients, patient attenders, or NSS, police.
Ma'am, your voice is breaking, ma'am. Just a moment.
Workers. Yeah. Am I audible now? In the chat box?
It's improving, ma'am. It's back to normal now. Thank you. Please go ahead.
I'm so sorry. Yes. So
just recap the last 30 seconds, ma'am. Yeah.
Yeah. Okay. So they are writing. I think they can hear me. So students, yes, most of us, our target learners are students in the center. So could you all just type and let me know who your target learners are based on your context? Yes, for most of us, it's students. Anybody dealing only in the corporate setting? I know one of my colleagues and one of our executive members itself, Vaibhavi, they lead mainly to healthcare providers. So that is her target learners. Students, professionals, community, yes. Yes, thank you. So I think from the chat, it's quite obvious that majority of us are for students. Raj, any chat I'm missing?
No, ma'am. It's all students only, ma'am.
Yeah.
Everybody is talking about patient care, safety, competency, UG, PGs, faculties.
Mm-hmm.
The general theme is students. Yes.
General theme is students. Okay, yeah. So next, so now we know why we need a center. We know who our target learners are. Now let's see what are the services or what are the programs you're going to deliver. Is it UG program, PG program? What are the courses, emergency courses, routine curriculum based, or your CBME, certifiable skills? Or Indian Nursing Council has a full set of courses. So just reflect and introspect within your context. What are the services or what are the programs and courses you will be delivering? I really want to take some time here because I want our participants to understand what the needs are so that they become an important stakeholder to the management in setting up or revamping their SIM center within the Indian context. Yes. So medical students, dental students, thank you. Faculty training programs, yes. Undergraduate, postgraduate student into professional education. Yes, thank you so much. Nursing students, yes. So more of
Someone
nursing
mentioned
programs.
EMS as well. Ibrahim mentioned EMS instructors as well.
Yes, Raj. For certifications, yes, you will provide whether international, national, or certifications, fellowships. Some simulation centers offers fellowships or PhD programs in simulation. Yes. Public hospital staff, yes, you need to provide programs for that. Yes. Yes, thank you so much for that. Okay. So now we have an idea as to what services each of us within our context and our team. Now, I wouldn't want to put this challenge on you all on how to improve the existing center, but just 1 minute on what your strategic planning is. Okay, now imagine you are doing a UG program, a UG nursing program. So your strategic planning means, okay, now we already have a center, we are doing our nursing UG program. Next, over the next 2 years, we want to integrate the PG program. Now, similarly, for all of us now, under the NMC mandate, we are doing CBME, certifiable skills, simulation, SP program presently. But very soon, and it's already out, the PG CBME curriculum is out, which again warrants back all your back to your skill lab and the hours there. So that could be the strategic planning. Maybe we are doing a few of the courses right now, which are your state courses, whether it's your if it's our National Resuscitation Council courses. Next year we want to move ahead and we want to maybe go ahead with an international organization course, things like that. So that is what you are going to do your strategic planning. So thank you so much for this activity. I really appreciate it. Yes, invasive procedures for drug administration. Yes, routes of administration. So probably you're catering to your first and second years, and now you want to move on to the clinical areas. And especially now with CBME, I will keep using that word because that is the word right now. 2000, now that batch has come to the third year and everyone's trying to integrate those clinical certifiable skills. So that could be the strategic planning we have for the next. So thank you so much for this activity. When do you plan to open the center? You need to know that before you present the report to your management as to why we need, who are target learners, because all this will affect on the next step. So when are you planning to open or revamp your center? Set up a time frame on within the next 6 months, within the next 1 year. So you have a time frame on how to work on your project. So with that, I'm going to now cover the first D, with all the perspectives I've received from you, needs assessment. So in the TIPS acronym, I'm covering the T, target. Is it only academics? Is it hospital? Is it community? Is it standalone? You have decided on your own through the chat box what you all want, who your stakeholders are. You've already mentioned in the chat box, undergraduate, postgraduate, or the healthcare professionals. You've decided what programs you need. Is it going to be a single program? Is it going to be a multiple? And very well said by a few in the chat box, we want an interprofessional simulation program. Determine the center's vision and mission. Very, very important. Whenever we go for accreditations, we'll say, okay, just, do a vision, do a mission. But personally speaking, I will tell you how much this vision and mission has helped us to move forward from the last few years. I will come back to that, but you need to know what your center's vision is. What is it that you want to achieve? Okay, where do you want to reach? We want to be a globally acclaimed simulation center. We want to be world renowned in simulation research. We want to be the best in hospital integration program. We want to, that's your vision. And the mission is how are you planning to achieve it? So determine your center's vision, mission. And that needs assessment will also cover, the administration is going to tell you, this is our proposed budget. This may be our personnel. We need to cover that in our needs assessment, because based on the budget, and then we decide on our next step based on who our human resources are and what technology. So this also needs to be a part of your needs assessment. And like I mentioned, what is your next future short-term or long-term goal in your strategic planning? So the first phase is over. We've done the needs assessment, and your leadership was quite impressed with the way you performed the needs assessment and has appointed you as a project manager. Congratulations, a round of applause for you. Now you are faced with the task of the second step, enlisting the investment required to revamp your center. So now again, Raj, back to the chat box. Now, what are the resources you require? Now, this is a very tricky question, budget. Now, let's see if we consider your plan, what is the rough budget you need to either set up your center or to revamp your center? Anybody, random numbers you can put up on the chat box. If it is an MC requirement or INC requirement, square feet is available, skill trainers are mentioned, you need to pay your simulation center staff. So let's know roughly some number. What do you think is going to be your proposed budget, which you need to present to the management? Raj, do I have anything on the chat box? Or they are still calculating?
Dr. Pragdish Raja has estimated 3 crores.
Yes, okay.
Waiting for more numbers.
Yes. You can feel free to write anything on the chat box. You don't have to pay to ask. 50 lakhs?
Raksha Deepak says 50 lakhs. Ganesh Mailapuram says 4 crores.
Okay.
Shiva Ratnabai says 3 to 5 crores.
Yes. So it's based on your requirement, okay? So your numbers may be different. So it's based on your requirements and your numbers may be different. So keep that in mind. Okay, so we are getting a lot of numbers in lakhs and crores. So let's see, now you have your budget ready. What about the infrastructure? Any idea how much square feet you require? Which part of the campus it needs to be? Just reflect on it. Should it be a part of the medical college building, nursing college building? Should it be standalone or should it be near the hospital? How far away should it be? Within the campus, students need to come, professionals need to come. What all do you require? How many rooms you require? And whether you require, how many washrooms you require an elevator, which floor of the building you need it, 8,000 square feet, okay. Now, regulatory bodies like INC and NMC have, just given it to us in a plate, 100 students, this much square feet, 60 students, this much square feet. Within the campus, yes. In the campus, yes, okay. So you are now introspecting and reflecting on what the infrastructure is. Thank you for that. I really like this audience, very active and lively audience. Thank you so much. Now the equipment. Let's look at the, okay, 8 simulation rooms. Thank you so much. Now let's look at what equipment. Now you have decided what your program is, your needs assessment. You have decided, is it UG, PG, medical, nursing, how many students are there? And now you have rough idea of how much budget you need. So let's see what equipment you require. Now let's switch on the chat box to what equipment you require. It again boils down to not what equipment we have, but equipment what you think you will need to satisfy your needs assessment. What equipment you require. Some centers may not require an equipment if they're planning to do only an SP program. But even then, you will require a few consumables and equipment, non-invasive equipment. So anybody? I think they are typing because the equipment list is big. Raj, if you get something, just let me know.
So we have Dr. Raksha Deepak answering one high fidelity setup, many part-time trainers.
Okay. So a lot of part-time trainers to meet all the certifiable skills. Yes.
One high fidelity at least.
Yes, definitely. Yes. It again boils down to how much is your needs assessment. Yes, thank you, Dr. Raksha. So you have decided what all equipment. Okay, you need all the BCLS, ACLS equipment. As per the skills, consumables, thank you, Akansha, like the monitors, the ambu bags, the IV lines, basic and few advanced. You need computers, software. Yes, thank you, Dr. Shiba. You need all that equipment, the AV equipment. How can we ever forget all that? Yes. What about the human resources? Let's go back to human resources and the most important investment you need to do here. Who do you think should be a part of Skill Lab? Just name. You have all the luxury to name here. Trained tutors? Yes. Okay. So faculty is a part of your human resource. Skill facilitators? Yes. Who else do you need? Nursing faculty, okay. Hospital nurses, yes. Any other human resource you'll need? Administrators, technicians, thank you so much. The life of the simulation center, simulation technicians. Faculty, yes. Employees for the administrative work. Educators, subject matter experts, thank you, Dr. Shiba. Faculties, technicians, yes. Trained tutors, yes. Anybody for housekeeping staff? Anybody for secretaries? Anybody for managers? So these are the other human resources you definitely require. And please think of them. Don't forget full-time housekeeping staff. You definitely need it. Okay. So thank you again, all of you, for this second activity. So let's just summarize. Okay. Now, in the acronym TIPS, we have decided what our target is based on our needs assessment. Now we are going to do the investment, the tips on what all we require, the budget based on needs analysis, phase-wise. Roughly, I can tell you based on our NMC requirement, anywhere between 2 to 3, depending on if it's UG, mostly for the UG NMC CBME curriculum. Roughly, equipment can cost, again, depends on what branding you're looking for, roughly around 2 to 3 CRs will do. If you want PG and a little high tech, I think you will be able to manage with around within 10 CR. This is only equipment, not about the infrastructure. Right now, again, everyone's having a status issue, like we have more square feet than them, and which I always feel in a center, like we need to have nodal centers where the resources can be shared. Hopefully, as a very simulation enthusiast and advocate of sharing resources, hopefully we will be reaching there someday, where we have nodal centers and where we are sharing resources. I think we need to go there sometime. Now, coming back to center design, again, what is the purpose of your center? What are the programs you're delivering? Or like all of you mentioned, simulator rooms, control rooms, debriefing rooms, skill demonstration rooms, audiovisuals, storage room, very, very important. How much ever space we have, storage room is something which we require for a fully functioning simulation center. Electrical room, manifold room, if your high-tech mannequins need medical gases, reception, faculty room, washroom, pantry, dining room, food court, furniture, air conditioning, and so on. So this will be a part of your center design. Again, equipment, I'm just going to broadly classify. based on your needs analysis. Part-task trainers, high-tech mannequins or human patient simulators, VRs, ARs, mixed reality simulators, AV equipment, consumables, your printers, your computers, whatever equipment is required, based again on your needs assessment. And you need a simulation director, you need a manager, scheduling, running the show, technician, clerical staff, program directors, course directors, instructors, facilitators, biomed, IT staff, housekeeping. So what I've written here is what we have right now, and I will give you, I will just share how our organization chart works. So this is on what you need to invest. And when I say human resource, I really want to reiterate the fact the admins, if anybody is attending this, need to invest on human resources. We need to motivate them, train them, and definitely acknowledge or reward. When I say reward, it need not always be a financial incentive. A part of the appraisal program, all the facilitators, as it is, when you ask the faculty, we are overburdened with a lot of clinical work, with a lot of academic work. Why do we need? What's in it for me? Okay, so as a part of the appraisal, financial incentive would be good enough for paid programs. Otherwise, at least a part of their appraisal programs. Please, facilitators need time. They spend time and effort. We need to train them with standardized training, and a lot of motivation is required. So now we've finished the resources, we've invested, and our simulation center got inaugurated last week. You have been designated as the director of the center. Now you need to present to the management what is your short-term and long-term goal, and what is the strategic plan next. What are you planning to do? You've asked for all this. How are you planning to go about? So now when we decide how we are planning to go about, let's listen to your perspective. We've decided we have to. Now, whenever somebody gives us a project, everything is set up where to begin. Now, let me go back to this chat. And those of you who are already running simulation centers, can you just type in 3 most, anticipated challenges you are facing in running the simulation center? I can, guess as to what you're going to do right now, because we all went through the same thing. So could you just let me know what are the challenges you are facing right now in sustaining your simulation center? Because based on that, we have a strategic planning. Any challenges you are facing right now? Balancing with department and simulation center management. Yes. Thank you, Dr. Renuka. That is something which most of the, I'm sure it's universal, balancing your clinical work. And most of these faculty are the dynamic faculty who have their legs and hands, in every committee and every center. Difficult to manage both parent department. Yes, that's what I said. I can actually guess. So faculty time, no firm support from the management. So a proactive management, yes. Getting trained facilitators, maintaining the mannequins and the computers. Okay, yes. So equipment maintenance. Addition burden, yes, that is going to echo now with everyone. So yes, faculty time is a huge challenge. Maintaining the equipment is a huge talent. A huge void of simulation technicians in our country. As a society, with Raj's permission right now, we are coming up with a SimTech course. No help from other department faculty. Yes, we don't usually have buy-in. So it's kind of like you go sit in the skill lab and your work also we have to do kind of stuff. In manpower, again, human, some faculty are not interested. Okay, that is where what's in it for me works. Incentivizing works, appraisals work. Everyone needs promotion, simulation research, something, IJOS is there, come publish. So get them to come and do a project, get them to collect data from your sim center, and they can publish paper. I'm just talking about what we have experiences. So thank you so much for mentioning all that. So those challenges again, Again, maybe because most of us are educators, but from the administrators' side, again, budget is a huge constraint. The money required to invest in, so that is one challenge some people face while getting, and during the COVID, definitely getting on-site people, again, the software required for remote simulation. So the most common, which I can echo, is human resource, trained facilitators, and a technician. Thank you so much. Now let's see what are y'all doing what are y'all doing, to formulate possible strategies about faculty time. I'd really like to know, how are y'all managing? How are y'all managing? Now, when we say no support from management, one thing I need you to know is setting up a skill lab and running the show is a regulatory body requirement. So that needs to be convinced to the management that it is a regulatory body requirement and it is their need to run the show. Seats get cancelled. Second, what about managing faculty time? What are you all possibly trying to do it? One definitely is, okay, you can incentivize it, but again, budget is an issue. How do you manage the show? Definitely nowadays, most simulation centers are managing the show by taking skill lab fees. So skill lab fees will help to run the show a little. Regarding budget for consumables, meet up with your pharmacy, meet up with your general stores, ask them for expired products, go back to the vendors. They usually give you a lot of expired products or discarded products where, you can save a lot of money on that. Sustaining the program, recruiting junior faculty members. Yes, that is a good suggestion. Junior faculty usually interested, ready to step up the ladder. Career option. It is a career option for more. When we started, we had a little resistance, but I'm so happy to let you know that we have 100 plus adjunct faculty who are a part of the simulation center, very keen to know because they have a stepping up of ladder. Few paid programs are incentivized, faculty time is given, and once you show return on investment or once you show some output, the management definitely will be proactive. Decentralize it, yes. Okay, so you can decentralize. This program is managed by this person, that program is one. Capacity building and TOT, yes. Faculty who are generally interested, they usually come forward. Scholarship option, research options, yes. So a few strategies to manage. Again, how do you convince the management? It is a regulatory body requirement, so they need to be convinced. And there is a little bit, especially in the private colleges, a little bit of stature also involved. Department-wise, yes, it becomes a mandate that, thank you, Dr. Hemant, it becomes a mandate that the department, everyone should be a part. Now, that's what happens for us here, physiology department, biochemistry, because of the CDME certifiable skill, all the department members are recruited to be a part of the center. So there's no, we are not getting support. It's not a single man show. I'm sure you all will reach there. So how do you ensure that you're sustaining your center? What are the programs? Thank you, Dr. Murray, that you have made it a mandate. That's what exactly, one of the strategies which you can do. Now, what about the programs and policies? Now, you've decided what your programs are. It's a nursing program, medical program, interprofessional program, and you've decided your goals. So lay it down. Lay down your program goals and objective, what you're planning to do within the next 1 year, what you're planning to do within the next 2 years. How do you set up SOPs to develop your courses? How are you going to evaluate these courses? Not just assessing your learner. What is the standards you're using to develop scenarios, faculty training? How do you assess your participants? At the same time, also you need a set of policies. Who can access the center? How do you open up your center? How do you close the center? What is the flow chart you need, to access your budget plan, to present the annual report? What about operations? Who can handle the mannequin? Who can handle the software? What happens to your equipment when there's a maintenance issue? What about safety of your participants, both physical and psychological? What about customer relation with your vendors? Most important, and definitely the public, the administrative or regulatory bodies, course development, scheduling. What are the policies related to staffing? What about working extra hours? Do they get incentivized? Do they get compensatory off? How do you train your instructors? How do you recruit your instructors? What about your participants? How do you assess them? If there's a conflict of interest, do you share the checklist with them? So many things. Research, a crucial part of simulation research. Who funds your research? From where do you get the grants? Who approves your research? So all this needs to be laid down in your policy and procedure manual, which I will again share with you. And once you have this, how do you sustain it? Keep revisiting, go up, look at your mission and vision. Where have we reached? Yes, we have integrated into the curriculum. Okay, now we need to move one step forward. Let's move on to research in the next few years. Let's start a new program. How do we reach there? How can we convince the organizational leadership? What is our planned budget? How do we get return on investment? Mostly all the colleges now are taking fees from the skill lab. They're getting support. They're getting grants. And how are we going to manage? Make some paid programs. Now, I will honestly tell you that the American Heart Association AHA programs are the bread and butter of our skill lab training. So, that's where we are able to stay afloat, including the student fees too. So we can break even and spend, obviously most medical colleges and NGOs, that can be spent on the hospital training programs. You can, go back and train your nurses and your technicians and your healthcare providers with that. Faculty development, crucial. To sustain all your programs, that is very crucial. How do you recruit every year? Okay, how do you update your database every year? Promote certifications. Try to sponsor your key stakeholder faculty and send them for certifications, and send them, make sure that their training is standardized. Again, I need not mention about education research. And one thing very close to my heart is use your skill lab for training the hospital, or hospital system, integrate it into your hospital system, and make sure your policies and plans are having a quality assurance. Do not fail to evaluate your program. Regular evaluation, programmatic evaluation is a must, and include assessments of your participants. And to know all this, where do I begin? Go back to international standards and accreditation. SHS, we are coming up with our own standards. It's in the making right now, and hopefully within the next few years, we will be able to do a national accreditation along with INC and NMC. So that gives an idea of the tips, the acronym. Just next couple of minutes to share what we are doing at Father Muller Simulation and Skills Center. This is a mission statement where we are right now. They are part of the educational curriculum. We are a part of the hospital training program, interprofessional, interdisciplinary, and we are contributing to the field of simulation-based research. It's coming there. It's out there right now. A lot of projects in the pipeline. From 2015, when we set up, before the requirements, so we were in a little better off place when the CBMA came. This is a timeline of 3 years up to 2018, where we initiated most of our programs, where we've done networking. At one time where it was called stimulation program, and now everyone at least is repeating and saying a simulation program. Networking was the key here of holding conferences and workshop and convincing the management. What worked in our favor? Proactive management, budget, oversight, policies, strategy to convince the leadership, getting resources. All this, we started with one secretary and one technician. A little space was given to us. We expanded a little, and crucial part, recruiting the faculty, how to go about, making it, like somebody mentioned in the chat box, it's mandate that you should be an ECLS instructor. It's a mandate that from every department or every unit, since it's CBME, every person should come, undergo our MEU programs, and then trying to give them a protected time. I won't say they have reached there, but yes, we will hopefully, and recognizing and acknowledging these faculty. What framework did we follow? Go back to our mission. Why are we doing a particular program? What is our outcome? Set the objectives, competencies, try to include the teamwork and collaborative practice. Based on that, we come to our instructional design. Okay, how do we plan our program? What's our lesson plan? What is our template? How are we going to assess them? What are our objectives? Do we need to integrate? Why physiology students are coming for MI? biochemistry students are coming for MI. Why don't we do horizontal integration? Get the two faculty. It's the same set of learners. You're saving on your resources. So we think of horizontal integration, longitudinal integration, definitely assessing the learners and evaluating the program to maintain our quality. We get a lot of feedback from the learners and from the faculty, which helps us to improve the program. A feedback as simple as, ma'am, the room is so cold, so next time make sure that the remote is there and you've adjusted your air conditioned temperature so that it is a good learning environment for your learners. This is our 80-page book of policy and procedure manual released in 2019. We update it and amend it every year. You get all this information there. Template was taken from SSH. Everything mentioned, who, what, where, everything is mentioned over here. So have a policy and procedure manual so that you'll know what is happening. This is our organizational chart of the Simulation Center. We are blessed to have course directors from each specialty. They handle the core faculty and the adjunct faculty. We have a separate set of our AHA instructors and our Jiva Raksha instructors. That's our management. We report directly to the director of the institution. And I have an administrative in charge who works hand in hand with me for the programs. Around 7,000 plus square feet. We have beautiful simulation centers in the country, which are 10,000, 12,000. So again, your needs, how much of rooms you need, what is the requirement, you'll decide. Based on what your core competencies are, you decide your simulation modalities. So again, go back to your needs assessment and you decide. Have a template for your lesson plan, have a template. So it is a strict policy for us. Any faculty come to take a session, they send us the lesson plan, we go through the lesson plan, they send us the SE template too. NMC Skill Lab, I'm sure most of you skill educators or administrators must have received this. So we needed to fill, what are we doing? How many hours are we teaching? What are the modalities you have? So this is what we submitted. Now to come back to the Indian context over the last few minutes, I can share this. It's available on the public domain. For those of you who don't have it, please email me. It is mentioned in the NMC skill module. In the last annexure, if you have 100 students, minimum you need to have at least 2,000 square feet, so many rooms, debriefing room, randomly, what are the things you require? Everything is mentioned on this annexure as per the NMC requirement. So when they come for inspection, they're going to have a look at this. Like everyone mentioned, most of it is part-task trainers. Again, a document had come out from NMC last year regarding COVID skill labs. So this is something I want you to have a look. I'm sure most of you would have got it. What is required if you are a dedicated COVID center? If you require the link to this document, please do email me. PG curriculum is out. I'm from the anesthesia department, so I'm just sharing this. CBME PG curriculum is out, and need for skill lab has been mentioned, and the simulators required have been mentioned. What are the skills they need to achieve also has been mentioned based on what residency program. Coming to the Indian Nursing Council, very soon next year, it's going to be semester system, and they have also mentioned what is the skill lab, simulation lab requirement for 60 students, where it should be located, what is the rough square feet in your nursing foundation and your advanced nursing labs, what are the mannequins and what are the skill trainers required. So to summarize, what is your tips toolkit include? So hopefully after this session, you are going to reflect on what your needs assessment is, what all do you need to invest on, what should be your programs and policies, and how are you going to sustain, and what is your strategic plan. So this is how I wanted to summarize, and all the best to each of you for revamping. Hopefully you will reach there. We all started that way with no support, convincing the management, but we are in a better place now, right now. And I'm sure you all will be in a better place. And I'll tell you why we are in a better place. We are in a better place because, again, every day go back to your vision. Have that vision put up in your skill lab. Ensure quality. Whatever you do, whether you teach, whether you assess, whether you make your policies, always take feedback and be open to feedback from your learners. Education, make sure you have a proper evidence-based education or instructional design. Go back to accreditation, go back to your MEU team, go back to your nursing education team, go back to the research policies of your hospital, contact, networking. Okay, this is how we network. Be part of societies, listen to webinars, contact people who have, tread the path and ask them. Teamwork, yes, I cannot stress on the fact you cannot manage the show alone. You definitely need it. Business is something administrators and so also try to think, okay, not running at a loss, how do you break even at least, or how do you try to do a return on investment, because that's how you can sustain your center. Have a strategy in place on what your short-term and long goal, step by step, what your long-term goals are. So thank you so much. Before I conclude and address your queries, we are coming up with an simulation center and our medical education unit. So we welcome you to Mangalore for the Skill EduCon, September 23rd to 25th. Most welcome. Registrations will open soon. Do contact me if you all are interested. It's a 3-day event with pre-conference workshop, basically on integrating clinical skills as per the CBME curriculum. So thank you so much. I'm open to questions. If you want, please do take my email. Over to you, Raj.
Yes, ma'am. So there's a question about space constraint, ma'am. Many old medical colleges with maximum number of students may have space constraints. How can this be solved?
Yes.
Can the skill lab be space department wise and could be considered the NC requirement? A departmental decentralization is what they're asking.
Yes, so most of the PG requirements also and UG requirements, we do have, OBG skill lab, or we have few equipments in the ENT. We have in our pharmacology department. Yes, you can decentralize it because of the space requirements. It's not necessary that everything should be in one place. So we have most of our routes of administration in our pharmacology skill lab. Nursing, they have their own. So they do come here when usually high tech is required. So yes, you can decentralize, and if you have space constraint, as per NMC requirement, they do mention 2,000 square feet for 100 students. Anything else, Raj?
Yes, ma'am. Can you please share your email with us? Thank you. Greetings from Alexandria, Egypt.
Yes, I will share my email. Raj, if you can just type out my email.
Of course, ma'am, I'll do that. Yeah.
I think.
It's LULUSHERIF
at fathermullah.in.
Yes, ma'am.
Yeah, I think.
FADHERMULLER.in, correct, ma'am?
LULUSHERIF at fathermullah.in.
Yes. Done. Okay.
Any other queries?
Thank you, Vijayanand sir. Not an initiation by me, so this is definitely Ulman's initiative. And I'm also typing the feedback form in the chat box, everyone. If you submit the feedback form, you'll also get a printable certificate directly to your email. Okay, so that's an added advantage of attending SHS webinars. We give you certificates for attending our webinars. So just a reminder, our journal is alive and kicking. So please submit your abstracts. It is ijohs.com. You can directly submit to the editor. We will consider your submissions and get it published as much as possible. So I'm just typing the feedback form here, the link here. There you go. The link is alive and you can click on it, submit your feedback, and get a certificate immediately.
So please don't log out of your YouTube channel before submitting the feedback.
Yes, it will be invisible after that.
And thank you so much for the feedback you're giving. I can read. Okay, there's a question, I think.
Yes, ma'am. Dr. Kavita is asking, is there any models in-house? I think
yes.
we're talking about low budget mannequins which are developed in-house.
Yes. So low resource mannequin, I can just give you one example of what our surgical faculty are doing. Now, circumcision has become a part of the certifiable skills. Not much available. So we are customizing, condom catheters and all that. So, yes, low resource mannequin. Even our nearby simulation centers are doing really good with low resource mannequins, especially our wear and tear mannequins. These are very expensive. IND is a certifiable skill. You can, be creative if you go to the kitchen and do a little bit of moulage and makeup, and how you can actually make them put incision and, the pus coming out. So these are a few ideas. If you all have, please do work on it, and you can present it as an abstract. We have a poster presentation. You can send us abstract in the upcoming conference. So work on the low resource mannequins. Thank you for that.
Just to recall from Simulcon as well, the team that won the competition was a low resource mannequin.
Exactly.
A simple box type skill trainer that was presented at the conference.
Yes, and they were medical students from GSL. I'm not GSL, sorry.
Gandhi Medical College. Gandhi Medical College.
Gandhi Medical
Yes, undergrads.
Undergrads, yes.
Finally, undergrads, they made a skill box, a simple skill box, which can be used to train at least 10 certifiable skills all by themselves. Yeah. And they made multiple boxes. They shipped it to the students who were attending the conference by courier. And it was a huge hit. And that won the competition prize as well. So in-house things are available. Yeah.
Yes. I think there are a few queries on the chat box, Raj, because the feedback is up. I think you need to post the link again.
I'm sharing it again. And ma'am, your email address will ask us. I'm sharing that as well again.
Can you please share your PowerPoint? Yes. I will send the PDF. Raj, you already have my PowerPoint. So just send the PDF version to whoever has requested. If you could just email. Raj, can you put up your email? We can send from SHS. You can send the if anybody wants.
I can do that, ma'am. Yeah, sure. info@shsindia.in. That should be perfect. Yeah. Yes. You can write to us here. Yeah. I'm just typing my email ID. One moment, and you can write to us requesting for the presentation PPT, and I will be able to mail it to you.
Yeah. And I think this YouTube link will be available if anybody wants to log in later, Raj. Yeah.
Yes, ma'am. It will be published. The video will be published. They have to subscribe to our channel, and you can watch all the webinar videos online. They're already available.
Yes. Thank you, and thank you for your kind, words. Thank you so much, everyone. You were a lovely audience, even though it was YouTube. Thank you so much for interacting. Interacting with us. And Raj, thank you for moderating. I think there are still questions coming up, Raj.
Mostly technical questions, ma'am, about the PPT and about watching the video later. So nothing related to the content as such.
Yeah. So if anybody wants the PPT or any other information, please do contact our secretariat, info@shhsindia.in.
Yeah. Okay, ma'am. I think we shall conclude it then.
Yes, thank you so much. And we are right on time.
Yes, ma'am. I'll keep the webinar link live for a brief moment, so all of you can open the feedback form as well, and then I'll stop the stream. Yeah. Okay. Thank you so much, Dr. Lulu. And
thanks, Raj.
Finally, we had this webinar.
Thank you. I know. Thank you. Thank you so much, Raj. Yeah.
Yes.
Yeah. You have my PPT, Raj?
Yes, ma'am, I do, ma'am.
Yeah, just change it into PDF. And just a request to the participants, these photos I've not put up because of consent issues. So otherwise, I would have been more than happy to share photos also. If you're interested, you can go to our website and have a look. Yeah, thank you so much. Yeah, thank you for the feedback, everyone. So Raj, I can leave, I hope.